Good morning, everybody. My name is Glenn Gomolka, and I'm the CEO here at the Mississauga Foundation. I'd like to thank you all for joining us this morning for the presentation of our 2024 Vital Signs Report. I'm super excited to share our findings and our research with everybody this morning. So I'm going to only spend a few minutes just to do a little bit of background information, and then I'll introduce our speakers and turn the floor over to our speakers this morning. I also did want to mention that next Monday at 11 a.m., we're going to be hosting another webinar. It's our grant information session. I think we're going to post the link in the chat. So if you're thinking of applying for a grant with the foundation this year, please join that important webinar because we're making some significant changes to the way we do our granting, and you'll want to attend that session as well. So just in terms of some background here, because of the number of people that we're expecting to join this morning, everybody's microphone is muted. But and I see already some people are introducing themselves in the chat, so please go ahead, introduce yourself and your organization in the chat. We're not necessarily going to be monitoring the chat, so that's a place where you can do a little bit of networking. We'll post a few links there. But if you have specific questions for the foundation or questions about any of the data that we're presenting, you can post those in the Q&A. I'll be monitoring the Q&A throughout the session today. We'll try and answer as many questions as we can. And if we don't get to some of the questions, then we'll respond back to everybody who registered with answers to those questions. The other important note is that all the information that we're going to talk about today will be posted on the Foundation's website on the Vital Signs project page. And we're going to post a link to that page in the chat. None of the reports are there right now, but as soon as the session closes, we will post them all there. So you'll be able to find all the information on our website at the end of today's session. So in terms of vital signs, what is vital signs? So vital signs is the foundation's way of gathering insights to understand the health and well-being of our community. And from the foundation perspective, it really helps us to focus our priorities and our work on the most pressing needs in our community. Now, in the past, our vital signs report has been a single report, and it's been a lot of statistical data. We've compiled data from sources from Canadian data, provincial data, and municipal data, and really try to create one report that summarizes the health and well-being of our community. This year, we partnered with Leger because we wanted to marry the secondary data with public opinion data. We really wanted to hear directly from Mississauga residents to understand how they feel about our community. What do they love about Mississauga, and what are they concerned about? And as residents, what do they see as the biggest opportunities and challenges facing our community? And I think you're going to find that the public opinion research and the associated performance indicators that we were able to derive from that research, along with the integration of the United Nations Sustainable Development Goals into this year's report, really adds a level of richness into the data and analysis that we haven't had in previous years. So as I said, in past years, the Vital Signs report was a single report. But what you're seeing on your screen is the picture of the summary report that you'll find on our website. And as you read through, and it really reads like a magazine, it's very similar to what you've seen from Vital Signs in the past. But as you read through the report, you may want to access some deeper level of data. And so in addition to the Vital Signs report, we also will house a full comprehensive primary research report on our website, a comprehensive secondary research report, and this will go into a lot more detail than you'll see in the Vital Signs summary report, which is really the highlights from the primary and the secondary research. And then the last piece that you'll find on our website is also a one-page report card where we tried to compile all the real highlights from the public opinion data onto one single page where you can get in a single snapshot kind of the health and well-being of our community. And of course, none of this would be possible without the generous support from our sponsors and supporters. And so I'd like to offer my sincere thanks to this year's presenting sponsor, Novo Nordisk, our vital sponsors, Bank of Montreal, and our indicator sponsors, Connor Clark and Lunn and MNP. And now it's my pleasure to introduce our first speaker, Adam Rosella. Adam is the Director of External Affairs at Novo Nordisk, Canada, and he sits on the Board of Directors for the Mississauga Foundation. Adam has been an amazing partner for the foundation. Adam and Novo Nordisk have been an amazing partner for the foundation and for our community in general. The foundation partnered with Novo Nordisk several years ago when Novo Nordisk wanted to create a chronic disease fund. Now, this fund generates grants that support a wide range of charitable projects aimed at addressing social determinants of health in Mississauga. Novo Nordisk has been the presenting sponsor for the past two Vital Signs projects, making it possible for us to deliver this work in our community. And so with sincere thanks, it's my pleasure to introduce Adam to make some opening remarks before we turn things over to Leger to present today's vital signs.
Thank you, Glenn, for the kind introduction and the opportunity to make a few opening remarks. As Glenn mentioned, I'm a proud member of the board of directors at the Mississauga Foundation and also the director of public affairs at Novo Nordisk in Canada. Novo Nordisk is a global healthcare company founded in 1923 and headquartered in Denmark. Our Canadian headquarters are based right here in Mississauga. Our purpose is to drive change to defeat serious chronic diseases built on our heritage in diabetes that traces its roots all the way back to the discovery of insulin in 1921 at the University of Toronto. We work towards this purpose and ambition by pioneering scientific breakthroughs, expanding access to our medicines, and also working actively to prevent the diseases that we treat. A key component to advancing chronic disease prevention is through public-private partnerships like Cities for Better Health and the Novo Nordisk Network for Healthy Populations, both of which are based here in Mississauga. According to the World Health Organization, non-communicable diseases accounted for 74% of all deaths in 2019, largely driven by diabetes, cardiovascular disease, cancer, and chronic respiratory disease. Additionally, we know that obesity is a rising global pandemic that is linked to multiple health complications. Today, there are staggering incidence rates of obesity around the world. In Canada, almost 2 in 3 adults and 1 in 3 children and youth are overweight or living with obesity. And these numbers unfortunately are trending in the wrong direction. Because of the scale of people impacted, access to effective treatments isn't enough to solve the problem entirely. We urgently need to work together on disease prevention efforts and early detection. Novo Nordisk Canada's involvement over the past several years with both the Mississauga Foundation and the Vital Signs Report reflects our commitment to driving a deeper understanding of local data and insights that enable better local decision-making in the area of chronic disease prevention. This includes understanding how residents perceive we're doing as a community around the UN Sustainable Development Goals that you'll be hearing about shortly from Paige. You really can't talk about health in isolation from other social determinants of health, like food security, the economy, including affordability, housing, jobs, transportation, and safety. That is why we felt it was so important to support this year's Vital Signs Report as the presenting sponsor. We know from our decade plus of work with Cities for Better Health that local context and voice matters deeply when it comes to setting priorities and collaborating on the best solutions. I urge all of us attending today and seeing the vital signs data for Mississauga to keep an open mind and seek to expand our own understanding of what the priorities are to the residents of our city. Thank you, and now I'll turn it back to you, Glenn.
Thank you, Adam, and thank you again for Novo Nordisk for your ongoing support for the foundation and for the Vital Signs Project. It's my pleasure now to introduce Paige Schoenfeld. Paige is the Senior Vice President for Leger. We chose Leger as a partner for this project because Leger is an industry leader and expert in the field of market research and public opinion data. And Paige has brought more than 15 years of experience to the table for this project, including past projects with other community foundations from across Canada. Paige and her team have been intimately involved in this year's Vital Signs Project right from the inception until today's presentation. We're very fortunate to have Paige here today to join us to walk us through the public opinion portion of the Vital Signs research. And so I'm going to stop sharing my screen now, and I'm going to turn things over to Paige, and the floor will be all yours.
Great. Thank you very much. Just want to get a thumbs up. You can see the presentation and hear me. Perfect. All right. Well, thank you, Glenn, for that introduction, and good morning and Happy New Year to all of you who have signed in for the live presentation today. It's been great looking at the chat, seeing just what a diverse group of attendees we have today, and encourage you to ask questions in that Q&A as we go along. So thank you for joining us on this walkthrough of the Mississauga Foundation 2024 Vital Signs Research. As Glenn mentioned, my name is Paige Schoenfeld. I'm representing Leger today, and some of the research outcomes that we conducted for the Mississauga Foundation. And we have actually done this for other foundations in Canada as well. So we are deeply familiar with the Vital Signs program. And I'm honored to walk you through the key findings and insights that were important to this research. I will be focusing largely on the primary research today, but I'll be integrating some additional components as well. And as Glenn mentioned, the presentation today is just a very small fraction of all of the research that's included in the magazine and the additional supporting reports. So some background. The Mississauga Vital Signs Survey, it is a tool that helps to measure the vitality of the city. It identifies significant trends and assigns letter grades on areas that are critical to the quality of life in Mississauga. We use a very simple grading scale ranging from excellent to poor to evaluate 13 key areas of the community's well-being. And when I say we use a simple grading scale, this is essentially how people in your community provide a grade scale. And then this year's findings highlight areas where Mississauga is doing well and where there's areas to improve. So the methodology for the primary research included an online survey. It includes 546 responses. 399 of those come from the Leger-Leo panel, and 147 of those via an open link that the Community Foundation distributed. And this ensures a robust representation of various community voices. The survey ran last summer from August 15th all the way through October 4th. And the data was weighted to ensure representation of the demographics in the area as well. Now, the average grade that we're going to be spending a lot of time talking to you about today is derived by taking a weighted average or a mean score from the excellent to poor grades that residents provided and compares it to a calculated range associated with a 12-point grading scale. So you'll see me talk about various grades all the way from A+ to a D-, or actually you can even get a failing grade. Thankfully, there were none that we'll discuss today. But we also conducted secondary research providing which provides a report on key data points in your community on those 13 topic areas. And those are integrated to the magazine. I'm only going to touch on a few of the points from that detailed report today. Again, mostly focusing on the primary research in terms of what residents told us about the community. So the respondents in the survey represent a diverse cross-section of Mississauga's population, covering various income levels, ages, ethnic backgrounds, and tenures of those living in the city. This diversity helps us understand the needs and experiences across all Mississaugans. So we're really happy with the distribution that we were able to look at when we're providing our analysis. And with that being said, we know that Mississauga is one of the most ethnically diverse cities in Canada, and this is well reflected in the research. 48% considered themselves part of the BIPOC community, and 41% indicated that they were not born in Canada. And now, just to compare Mississauga to the rest of Canada, that proportion of BIPOC community and those not born in Canada is much larger than the general population in Canada overall. And I'm sure many of you know that who are on the call today. So, and we also got a good mix of those individuals that had across the various income brackets. So those with a household income of less than $50,000, those between $50,000 and $110,000, and then those having an income of more than $110,000. It was generally very well reflected. So now that we have the background, the details out of the way, I just want to start off our conversation today really around a snapshot of what we found that highlights some of the key themes that arose. So overall, residents rated their quality of life positively. Diversity was the strongest topic area in the 13 topic areas. Where we saw some concerns or issues is really around affordability, housing, and the cost of living especially. These stand out as major concerns. Economy and transportation also emerged as some key areas that are needing some attention. And then it's also notable that there are some safety concerns that are on the rise. So you'll see these themes noted throughout the presentation today. So look out for those, and let's get into the detailed results. And we'll get into the detailed results first by starting off with a little bit more of a broader point of view. So just sort of overall quality of life. And firstly, so this slide highlights what residents love most about Mississauga when provided with a long list. And at the top of that list is location, with 36% of residents appreciating its convenience and accessibility. Parks and green spaces come in at second at 31%, reflecting the city's commitment to environmental sustainability. And then we also see diversity as another celebrated aspect, with 28% recognizing it as a key strength or one of the best things about Mississauga. And other notable mentions include proximity to the airport, connections to friends and family, vibrant festivals and events, and a general feeling of safety. Access to educational opportunities, arts and culture also round out the top 10 list. So overall, these noteworthy top 10 reflect the unique blend of that urban convenience and a community that makes Mississauga feel and a community focus that makes Mississauga feel so special. So on the flip side of that, we also asked Mississaugans what they are most concerned about today, again, selecting from a long list. And unsurprisingly, the cost of living is just so predominantly at the top of that list, with 59% being the most pressing issue and it being a significant concern. Now, I just want to call out that this is also very much a Canadian issue, and will be a key ballot issue as we head into the upcoming federal election. Coming in second and third are crime and safety and housing. So crime at 33%, and housing at 32% in third place. And housing affordability specifically is one of the major challenges. We'll note this throughout the presentation, but these general insights underscore the importance of addressing affordability, safety, and infrastructure to improve the quality of life in Mississauga. So one other thing I just want to point out is that the cost of living concerns are notably higher among certain groups in Mississauga, specifically those who are part of the BIPOC community, those with annual household incomes of under $80,000, or those who are born outside of Canada. And in a lot of the newcomers research that Leger does, we do see a consistent and large gap between the expectation around the cost of living versus the reality as being a major concern or issue for those arriving in Canada. So given that Mississauga has such a diverse population, over indexes on immigrants and newcomers, this is likely more of a issue in Mississauga than it is for the rest of Canadians as well. So now we move on to the outcomes of grading scale evaluations, looking at the big picture first, overall quality of life. So Mississauga earned a letter grade of a B-. So how did we get this? Well, over 60% of respondents rate their quality of life as good or excellent, but there's room to improve, particularly on some of the issues noted already, like affordability and access to housing, and that's probably what's driving down some of these lower grading scales. But on the higher grade perspective, you are more likely to provide a higher letter grade if you are over the age of 55 or you earn an income of over $80,000. So that's going to, the people that fit in those groups are going to provide a higher letter grade here, more likely to indicate good or excellent overall quality of life. Now, on that point, let's focus on residents believe what would make Mississauga even better place to live. And we ask this on an unaided basis. And so that means that Mississaugans tell us in their own words, what would make it a better place. And so affordable housing tops the list, with 21% highlighting it as the most important improvement. Better public transportation follows at 18%, and affordability and cost of living come in at third at 16%. And we also see safety, less crime, and more police as the fourth issue. And so you can see that these results are kind of consistent with what we've been talking about already, and some of you'll see them consistent with some of the letter grades we're about to get into now as we go into their detailed findings component of our presentation. So here we have a summary of the key metrics and the average grade that each of the key metrics were assigned by Mississaugans. So you can see that diversity, equity, and inclusion stand out with the strongest grade as a B+, and housing as the lowest grade at a D+. And then there's a mix of those letter grades in between. And so we'll touch on that now, topic by topic as we go along, starting with arts and culture. So this slide focuses on how arts and culture are perceived in Mississauga. And overall, the category received a grade of a C+, indicating that while there are strengths, there's also some room for improvement. And on the right-hand side of the screen, you'll see that throughout the survey and throughout our presentation today, we asked residents on a 5-point agreement or rating scale their views on specific areas within the general topic area. And you'll see the results from those highlighted throughout today. And so what you see on the screen are the top 2 mentions. So in this case, those who rate elements good or excellent, and then the combination or the adding of those 2 scores in ranked order. And so for this specific topic area, we see that physical access to arts and culture was rated highly, with 55% of residents marking it as good or excellent. And similarly, the variety of events, arts and cultural events, received positive feedback from 52% of residents. However, the quality of spaces and affordability were rated slightly lower. And here we see that issue around affordability kind of creep into how people want to enjoy their interactions with arts and culture in Mississauga. So moving on to belonging. Feelings of belonging are relatively strong in Mississauga, with 52% of respondents rating it as good or excellent. This is one of the stronger letter grades overall. And this demonstrates the city's dedication to fostering inclusivity and connection across diverse groups, from newcomers to also longtime residents. Notably, BIPOC individuals are more likely to rate their sense of belonging more positively. So they're more likely to give that good or excellent score. And if you recall, that group represents almost half of the population in Mississauga. So these findings represent the success and the importance of continuing efforts to ensure everyone feels part of the community. So this is an area in strength, and continue to support that. It is a unique element to Mississauga. Now, building on that and the feeling of belonging and what it means for community engagement. So community engagement has mixed ratings. Younger residents, age 54 or under, are more likely to rate it more positively. Also, if you are a newer resident to Mississauga, you are also more positive than those who have been living in the community for a longer period of time. So think like 11 plus years or more, probably a bit more established. This suggests that opportunities to boost engagement with older age residents and those who have been living in the community for a longer period of time is potentially something to look at. And these overall sentiments are built on a number of factors. So it's not really about access to community engagements, as these levels were okay, but it's more so about the appeal of community engagements, and then also the ability to participate were the areas that were somewhat softer in this topic area. So moving on to diversity, equity, and inclusion. Diversity is one of Mississauga's, well, it is Mississauga's strongest category at a B+, with 66% rating it as good or excellent with an average grade of a B+. So notably, Mississauga hosts the largest proportion of immigrants in the Peel region, with 55% of its population being born outside Canada. And to give perspective, that's 2.5 times more, or almost 2.5 times more than what is seen in the Canadian population in general, just to give you a perspective of how unique the region is. And so diversity exists in the population, but it's also being rated very highly by people who live in the region. And it was also mentioned as the top 3 best things in Mississauga, as I noted already. So it's an area of strength and uniqueness to Mississauga, especially when we look at some of the other vital signs work that we've done for other community foundations. This is quite strong and unique. No, so building on this and feeding into that positive score are some detailed agreement questions that had relatively strong scores overall. Most agree, and well, many agree, that it is important to learn about and respect Indigenous culture, values, and traditions. And over half agree that Black, Indigenous, and people of color have equal opportunities, and that Mississaugans are committed to anti-racism, equity, and inclusion. So good to see some stronger scores here. On the side of economy, it also received some mixed reviews. So this is on the lower, like mid to lower end of the grades received. Only 46% of respondents rated it as good or excellent, highlighting significant concerns around job opportunities, household finances, and overall economic outlook. These are also some concerns that are facing Canadians in general today, but they are definitely felt right here in Mississauga. And this suggests that while some residents feel confident about the local economy, a substantial portion see room for improvement, particularly addressing issues around affordability and financial stability. Also going to be a big election issue. So moving on to an environment. Over half rated the environment in Mississauga as being good or excellent, while 1/3 gave it a grade of a C, so like an average. So this also is one of the stronger categories for Mississauga. It came up on one of the top things that residents like about Mississauga. Interestingly, those who are immigrants or newer to the region are more favorable and provide a stronger grading score in this case. So digging into what this means, ratings of environment are high, with specifically the availability and quality of green spaces and parks in their communities. So these were kind of the more highly rated elements, but you can also see that the other areas received fairly decent grades or ratings as well, with around protection of sensitive habitats and the cleanliness. Now, air quality was noted as the bottom, or received the lowest rating. However, it still received over half, indicating that it was good or excellent. So health and wellness. Health and wellness in Mississauga received a letter grade overall of a B-, reflecting decent outcomes, but also highlights that there are some areas that are needed for improvement. So the availability of nutritious and culturally appropriate food is the highest rated aspect at 66%. And I just want to take a moment and pause on this too, because we know that the population is so diverse in Mississauga that the fact that many feel like they're able to find culturally appropriate and nutritious food in their region is noteworthy. We know that from the newcomers research we do, that culturally appropriate food is really important to newcomers. And it seems like this is an area that Mississauga is doing pretty well on. So just wanted to call that out. Mental health and physical health rank second and third here at 58 and 55%. However, access is where we see some scores start to drop off. So physical access is only at 50%, and then access to mental health care in a timely manner is only at is only at 41%. So these are both significant concerns, as work-life balance. And so we know that given the growing focus on health and wellness in society, particularly around the mental health crisis in Canada, these findings emphasize the urgency for improving access to timely care and supporting Mississaugans in achieving that overall balance and well-being. And it does go without saying that addressing these gaps can contribute to healthier communities and a more resilient city overall, as we know that health and wellness is such a critical component. So housing. You saw earlier in the summary that housing received the lowest grade by residents, and it is a major concern. Only 32% rated it as good or excellent. Majority rated it, or not the majority, but most assigned the letter grade to 37 to a C, an average at 37%. So the issue is really around maintaining that quality of life and attracting new residents. This will impact those two elements. So it's a major issue for everyone. You can see here just in the overall results, but it's even more of an issue for those more vulnerable populations, specifically on this element, those who are younger individuals and those who have a lower income are more likely to give a much lower grade. So they'll probably be in that poor, below average assignments there, but so something to note there. And then one of the elements we found in the secondary research was in July 2024, the average home price in Mississauga exceeded $1 million. This reflected a 1.4% decrease from the previous year. So it's nice to see that we're actually seeing housing prices come down a little bit, or perhaps stabilizing. But at the same time, even though the increase in housing trend may be stabilizing in your area, at least in terms of home price, affordability remains a significant challenge for many residents, and being able to afford that $1 million house price is just so out of reach for so many people living in the region. And this shows up in more of the detailed data as well. So only 26% of residents rate the availability of supporting housing positively. And the situation is even more critical for affordable rental housing and home ownership options, with just 22 and 21% rating these aspects as good or excellent. So these findings highlight a pressing need for policies, initiatives to address that housing affordability and improving that access to suitable living arrangements for residents in Mississauga. So overall, the lowest grade and some significant concerns here is noted on this page here. So moving on to learning. So 3 and 5 rated learning in Mississauga as good or excellent, with about a third giving it a grade of a C average. Access to quality education is highly rated. So it's not really about the perception or availability of that quality education, but it's more about the ability to afford it. So this is where we see a bit of a disconnect, and where that affordability component is rated more poorly. So again, you see the issues of the affordability crisis, an issue that we've noted throughout this presentation, making its way into the learning component as well. So moving on to safety. Safety in Mississauga remains a mixed area of concern, getting an average letter grade of a C+. Safety is growing concern in Mississauga and is mentioned among the top 3 issues facing Mississauga today. Notably, males and immigrants and those new to Mississauga in general, rate safety is higher. So something to note about groups that may be feeling a little bit more vulnerable would be women, those who are perhaps been in Mississauga for a longer period of time. They're the ones that are providing the lower scores for safety. And digging into this further, we asked the simple question, do you feel safe in your neighborhood? And while 41% indicated they feel good about their safety and 14% indicated that they feel excellent about the safety in their neighborhood, a notable portion still rate their safety as average or worse. And then further building on that, we asked if crime in Mississauga and your neighborhood has increased or decreased over the past year. So just the perceptions, how is it changing? And simply put, safety concerns are rising in Mississauga. 67% of residents noticing an increase in crime citywide, and 47% reporting increase of crime in their neighborhoods. So these findings highlight the growing anxiety about safety and the need for enhanced crime prevention and measures and community support to address some of these safety concerns. So moving to a little bit of a lighter topic, the sports and recreation in Mississauga did receive very positive feedback, earning an overall grade of a B. About 62% of respondents rate sports and recreation as good or excellent. And so this helps this category reach one of the strongest grades achieved this year. Access, quality, and the variety of community facilities are all rated quite highly as well. However, the participation scores are slightly lower. So there's a perception of access, quality of facilities, variety of facilities, but the actual participation, get out and go, is something that could be worked on. So the infrastructure is there, but perhaps an opportunity to enhance that participation would further strengthen this category overall. So standard of living. Standard of living in Mississauga receives an overall letter grade of a C+, with notable concerns around affordability. So only 39% rate their ability to afford necessities positively. Only 39%. And living standards for seniors and youth are particularly low, with just 33 and 32% rating them as good or excellent. Additionally, only 30% feel their wages align with the cost of living. So we all know that the cost of living has increased significantly over the past couple of years, and only 30% indicate that their wages are reflected or increasing to match that. So these findings highlight the need for targeted efforts to improve affordability and support vulnerable groups, especially like seniors and youth. One of the more notable findings in our secondary research was from a statistic highlighted back in November of 2024. The city of Mississauga declared a state of emergency due to food insecurity. Specifically supporting that concern is food bank usage increased by 58% from May 2023 to May 2024 compared to the previous year. So this represents a staggering rise of over 200% increase in usage compared to pre-pandemic levels. So the demand for food banks, has increased and grown significantly, marking it the fastest rate of increase in food bank usage across Ontario, and that's right here in Mississauga. So that those elements are bringing down the living standard score in Mississauga. Males and those with a higher income are more favorable towards living standards in Mississauga, and that is generally consistent with a lot of the key metrics we have discussed today. So the final topic area for our presentation today, or specific topic area I should mention, is transportation. So less than half rated transportation in Mississauga as good or excellent, giving it an overall letter grade of a C. This is one of the lower performing categories and was noted as a key issue on an unaided basis by Mississaugans. And building on the overall transportation grade, we asked how you would rate traffic congestion, which is shown on the right-hand side here. And it's high, especially during peak times in Mississauga, which is likely contributing to that overall lower transportation grade. Specifically, public transportation was mentioned within the top 3 ways to make Mississauga a better place to live, with about a third indicating that it is difficult to get around using public transportation. On the left-hand side, we see we show how easy or difficult it is to get around using various modes of transportation. And overall, 3 and 5 rated getting around in Mississauga by a car the easiest way, which obviously further adds to the congestion, followed by walking and biking. So public transportation is ranked 4th there in terms of ease, which is likely contributing to those lower grades. So that is it for sort of the detailed walkthrough of the results, and I'll just leave you off with some final thoughts summarizing what we started off with and the detailed results. But overall, Mississaugans generally rate their quality of life positively, with 3 and 5 giving it a good or excellent grade. And this sentiment is stronger among older residents and higher income groups. Residents value the city's location and green spaces, and diversity is another highlighted area frequently mentioned among the top strengths of Mississauga, and also receiving the highest grade. It's when we get into some of the other details of the categories that we start to see some of the issues. Specifically, affordability was just commonly mentioned and noted as a challenge, particularly around housing and the cost of living, and which is also noted in a nationwide trend as well. Younger, lower income, and BIPOC residents feel these pressures more acutely. And housing affordability and the availability remain major concerns, receiving the lowest grade among key areas. Economic challenges persist, with less than 2 and 5 rating household finances positively, and many struggling to find suitable jobs or even entry-level positions. Transportation and safety are also additional areas needed for improvement. The rising safety concerns tied to perceived increases in crime emphasize the need for stronger public safety measures or supports for various communities, and safely is frequently mentioned as the top areas needing attention to make Mississauga better as well. And so overall, these findings highlight the importance of targeted efforts to enhance affordability, housing, safety, and economic opportunities while maintaining the city's strengths in diversity and green spaces. So thank you for your attention today. I hope this presentation provides valuable insights into Mississauga's strengths and areas for growth. I'm hoping we can continue to work together to make Mississauga even better. And I believe at this time we should have some time to answer some of the questions if there are any. And I will stop sharing my screen.
Great. Thank you very much, Paige. There are a couple of questions. One question was regarding if the data was broken down by participant identity. And so I had put in the chat that where identity was statistically significant, that you would be mentioning those differences, which you have done throughout the presentation. And I know in our reports that we've also called out on specific metrics where identity was statistically significant. We've noted those, but I wanted to know if you wanted to add anything to that comment.
Yeah, I'll just say that you're absolutely right. In the full report, we take a much more detailed view of calling out specific groups at a more detailed level. So definitely would encourage the audience to take a look at that report, and all the notable differences are there.
Great. Another question that we had was around safety data. And I know that, so I think one of the comments that I'll make is we're getting a question is that, does the Peel Police data, what does it say about crime in Mississauga? And I'll let you answer that question specifically, Paige, but I think generally speaking, one of the really interesting things about this research, when you add public opinion research and you try and match it up with statistical data, is oftentimes you can have a disconnect where the public kind of feels one way, but the statistical data may say something different. I think in large part, the stats really lined up with public sentiment, and we saw a lot of kind of reinforcing of what hard data was telling us. It kind of reflected what people were saying in the community as well. Did you have any comment on the Peel Police data for crime in Mississauga?
Well, I'd have to go back to the detailed results on that, but I think for the most part, it matches what we're seeing in the data here. We know that police presence and activity is also increasing, but does it match what is the public is feeling about that is I think where we still see the disconnect.
Right. Yeah, and I know I was looking at the Peel Police data recently, and I know that nationally, the crime levels are on the rise, and they are on the rise in Mississauga as well. So the sentiment of people indicating that they feel the crime is on the rise in the city is kind of supported by the data in general. There's another question here about inclusion of people with disabilities in the survey. So can you speak to the panel's composition and whether that was included?
Mm-hmm. Yes, absolutely. Those with disabilities were included in the survey. We have those individuals on our panel, and then also our surveys are designed to support those with disabilities as well. So those actions are put in place to ensure that we have them well represented in the data.
Great. And I know that I'm seem to be getting, there's a theme of questions about whether we can break out different populations or subsets of the population within Mississauga. And I would say that this is our first go at doing public opinion research in the city. It's challenging to break out the data into very small groups without having a really large panel size. So we had, I think it was over 600 people complete the survey. Page, is that correct?
Yeah, just over about 500, yeah.
So a little over 500 people complete the survey, which makes us feel really confident in the data at the macro level. But when we certainly get breaking down into very specific panelist identities, it gets challenging because the sample sizes just get small, right?
Yeah, that's right. So anywhere where we had a large enough base size to break out the different demographic groups. So looking at, within income brackets, within age groups, different ethnicities and whatnot, we called those out. But we would not indicate a significant difference or any shifts or differences between data if the sample sizes weren't large enough. So it's sort of, the answer is depends on which group and what you're comparing it to. Were we able to break that out further?
Great. So I have one other question here, which is with regards to access to physical and mental health services, and if the data represented challenges with accessibility of services and cultural appropriateness of those services, since of course we did include people with different backgrounds.
Yes, sorry, just let me read this question here.
I think it's asking about whether the accessibility was, whether the services were accessible and culturally appropriate.
Yeah, I don't know if we got into the level of detail on that. I can certainly follow up with this individual though, if that would work, or
Yeah, maybe that's one that we can take away and kind of report back on. And there's one other question about unhoused and what the city is doing. I don't think we're going to try and answer on behalf of the city. What I will say is in our summary report and in our secondary research report, we do link to reports from the Region of Peel and from the City of Mississauga, and so there are some links to reports on each of the indicators in terms of what the city and the region are doing in all of these areas. But I don't think we're going to provide a perspective from the city this morning. I don't see any other questions in the chat. And so with that, I'm just going to share my final screen and just again say thank you, Paige, for presenting the data today. There's a lot, I think you get the sense that there's a lot of data. And as I said at the beginning of the session today, the summary data provides a really good, and I've got a picture of it up on the screen again now, provides a really good kind of overview and summation of all the different reports. But if you want to dig into the data, and there's several questions here that indicate to me that people want to dig into the data and they want to see more, I encourage you to read the entire secondary research report and the entire primary research report, because they go into more detail. And there's a lot of additional data that backs up sort of the highlights that Paige shared with us today. So I'm going to conclude by just saying thank you to everyone for joining us today. Thank you to Adam and Paige for sharing your time and expertise with us this morning. I should also say a big thank you to our Community Leadership Committee and for all the time and energy that you've put into helping us to produce these reports and fine-tune our approach on vital signs. I hope that everyone found the session interesting, and I hope that the reports will help to guide policymakers, charities, and funders alike to focus on the most pressing needs in our community. From the Foundation's perspective, the launch of the vital signs is really just the beginning of the project. Our job now is to work with the community to unpack ways that we can facilitate progress, to exemplify the positives in our community, and to address some of the pressing challenges such as affordability, housing, public safety, and transportation. So let's continue the conversation. We're going to load all those reports on our website. Please go and download the reports. If you would like to connect with the Foundation, if you're interested in hosting a vital signs presentation, please reach out to us. If you want to discuss opportunities for improving health and well-being in the community, please reach out to us. And as a final reminder, on next Monday, January 20th, we are hosting our grant information session. The link should be in the chat, so please sign up for that if you haven't already. And with that, I would just like to say thank you to everybody for joining us this morning, and please enjoy the rest of your day.